Okay.
Brian, whenever you're ready.
Okay, very good. Thank you. Thank you, everyone, for joining us today for our webinar, Homelessness in the COVID-19 Era. And this is Brian O'Connor, Director of Public Policy for CCM, and you're going to be joined by others throughout the call. But before we get started, I do want to go through some housekeeping items. Basically, that this webinar is being recorded. A link to the recording will be emailed out to attendees and published on CCM's website. And also, to ensure the best audio quality, all attendees have been muted. We encourage attendees to ask questions, and to do so, please write your questions in the chat box throughout the webinar. You'll find the chat box when you hover on the bottom of your screen. You'll see the chat icon. You just click on that and be able to submit your questions there, and we'll be able to get to those after the presentations. You can introduce yourselves to the speakers. I think it's important to have your name and also the organization that you're representing. And as we go forward, I think part of the impetus for this is because of the population that we're working with the homeless population, and the congregate housing being a real problem area for as far as potentially spreading the COVID virus. And I think one of the things that we're trying to accomplish here today is to participate and work with, not only the Connecticut Coalition to End Homelessness, but also our partners with the state, the Department of Public Health, and the Department of Housing, and trying to do a regional or a systemic approach that will flatten the curve and also give you the resources and tools to handle some of the best practices, which our panelists are going to go over today. And also, if there's any spots that maybe are unique to your area or that are occurring, that you'll be able to approach those as well in this conversation. Before I get started, I did forget to name our sponsors here. We do have the Connecticut Coalition to End Homelessness, the Department of Public Health, and the Department of Housing. And I think, one of the things that we're trying, again, to do is to help establish best practices and also be able to focus on a very vulnerable population. And without further ado, I'd like to turn it over to Madeline Ravitch from the Connecticut Coalition to End Homelessness.
Hey everybody, thank you all for taking the time to join us today. We're grateful for all the work that all of you are doing right now. This is a huge team effort, and we're grateful to have all of you together today. We're going to spend the first half an hour of this call with a few presentations. We'll have Dr. Richard Cho, the CEO of Connecticut Coalition and Homelessness, giving an overview of the the COVID homeless response. And then we will have Commissioner Mascara-Bruno speaking. We're delighted to have her here to speak with you because the state has really been invaluable in these efforts. And then Dr. Sosa from the Department of Public Health. So without further ado, I'd like to turn this over to Dr. Cho. And then once we open it up, we'll please do, as Brian said, put your comments in the chat box, and we'll be reading them after the presentations are over. So thank you again for all your work, and turning it over to Dr. Cho.
Great, thank you, Madeline, and thank you, Brian. And just let me quickly say, it's never been clearer than now that the work to address a number of challenges, including homelessness, but now the COVID-19 pandemic, are the kind of work that only happens through really strong collaboration, both with government and the nonprofit sector, but also at all levels of government. And so we are at CCH are really excited that we had already formed a partnership with the Connecticut Conference on Municipalities previously around homelessness, and how valuable that partnership is playing out as we're now faced with a crisis that is unprecedented. I'm going to present just a brief presentation here that would provide some more information. Let me pull that up. Great. So, okay. As Madeline mentioned, we're going to do some brief presentations. I'm going to turn this over after my presentation to Commissioner Mosquera-Bruno, and then subsequently to Dr. Lynn Sosa, who's the Deputy State Epidemiologist for the Department of Public Health. And then we really want to have some time for question and answer. So very quickly, as most of you know, CCH is a coalition that represents over 100 members. That includes homeless shelter providers and homeless service providers, but also members of the community and the business sectors and government partners, as well as municipal leaders, actually, who are all committed to the common goal of ending homelessness in our state. And we've worked as part of a coalition because we know that homelessness is something that can only be solved through those partnerships. Let me say that when the COVID-19 pandemic began to emerge, we were approached from the Centers for Disease Control about what preparations were being conducted within the homeless shelter settings. CDC was particularly concerned because for two reasons. One, as Brian mentioned already, homeless shelters being a congregate setting where people are sleeping in very close proximity to each other and then are out and about during the day was a really challenging scenario for where there could be really rapid spread of the COVID-19 disease within the homeless population, but also to the general public, given the conditions that people were in. We pulled data in early March to really look at what the scale of the needs were. What we found was that at that time, there were over 2,000 people who were sleeping in, at that time, 63 different shelters across the state. A vast majority of those shelters are structured in congregate settings where people are sleeping in dorms or in bunk style arrangements where they're sleeping in beds that are often no more than a foot or a foot and a half or 2 feet apart, sometimes bunk beds stacked on top of one another. And so those are the kind of conditions that CDC was particularly concerned about, as what the science is showing is that social distancing, spacing people apart at least 6 feet is the best defense against cross-infection, and that would be virtually impossible to achieve in most shelters across our state. I will note that even in the last couple of weeks, we've seen a dramatic decrease in the shelter census. As of last week, we checked that our shelter census is down by over 200 people. Some of that is because some of the steps that the shelters providers across the state, in partnership with many of you on this call at the municipal level, have already taken to try to decrease new admissions to shelter, as well as find alternative housing arrangements, as well as permanent housing connections for people who are in shelters. So as I mentioned already, CDC had issued guidance in mid-March really on ways that homeless service providers can maximize social distancing and also adopt public health practices to minimize a spread of COVID-19 within the homeless population, as well as to the general public. There's particular concern because of the high prevalence of some of the very underlying conditions that make people be at more serious risk of illness with COVID-19, heart disease, lung disease, diabetes. Those are the kind of things that are in fairly high prevalence, up to a quarter to a third of the homeless population as diagnosis of one or more of those three illnesses, not to mention the conditions. CDC had provided guidelines about some basic practices that can be implemented. Some of those are the same as any one of us in our homes would implement, which is washing our hands, trying to maximize distance from other people, and also just increasing the amount of cleaning and hygiene practices. But what the major concern was that the CDC's recommendation was that ideally that beds for non-symptomatic shelter residents should be spaced 3 feet apart. If residents are showing symptoms, the recommendation was that the beds be spaced minimum 6 feet apart, and that physical barriers and dividers ideally should be between those beds. Many of the shelters in our state, as I mentioned, don't have the ability to space beds apart 3 to 6 feet apart. They certainly don't have spaces within their shelters where they could isolate any suspected or confirmed cases. And so we began working fairly early on with the Connecticut Department of Housing and Commissioner Mosquera-Bruno and Steve DeLella on figuring out ways to both help shelters to understand what the best ways are to implement some of those public health practices, but also on figuring out how do we really in a really short period of time dramatically reduce the number of people in congregate shelters and space beds apart. The focus has not been on closing shelters. It's not to move everybody out of shelters, but really to figure out how do we maximize social distancing. For example, many family shelters, the families are in their own self-contained units. There's no need for those families to leave those shelters if they can actually social distance within their own rooms. However, many of the individual shelters are keeping in close bunks, and really that was the focus of our efforts. As I mentioned, our goal has been really to implement both basic infectious disease preventions and also to reduce the overall shelter census so that we could maximally space people apart and comply with CDC's guidelines for social distancing within shelters, and also allow for spaces for quarantining and isolation, providing medical care, and determining when people need hospitalization and also returns, and also housing. So a quick framework that summarizes the way that we've been approaching this work is, one, again, to implement those basic public health practices in shelters. But as we've realized that there's only so far we could get in minimizing COVID-19 spread with just those basic practices, we really needed to have a more concerted, comprehensive effort to decompress our shelters and maximize social distancing. As of last week, we began working as part of the state's emergency support functions in partnership with Department of Housing, Department of Social Services, Department of Public Health, and other agencies to figure out how we can identify those spaces. I'll talk about that massive shelter decompression effort in a moment, but really to look at how do we both spread people apart, also reduce new admissions to shelter through diversion into housing. And meanwhile, the third component of our strategy is really to figure out how do we rehouse the homeless population into permanent housing. That has always been the focus of our work to end homelessness, was to help people get connected back to permanent housing. Much of that activity has really taken a bit of a hold or has slowed down because of COVID-19. And what we hope to do is, once people are placed into hotels or spread out, we can actually revive the focus on getting people back into permanent housing. And I'll talk a little about what we're doing there. This is just a map of the Coordinated Access Network regions. As most of you know, homeless services have now been organized into regional homeless services networks. There are 7 different regions, and you can see how your towns and cities are aligned with your particular regions. But this regional infrastructure has proven critical in helping us to provide information to the shelters across our state, as well as to mobilize what will be a fairly significant shelter decompression effort. I'm going to skip that. So let me get to the shelter decompression effort. Again, our purpose has been to prevent outbreak and rapid spread of COVID-19 within homeless shelters and by homeless shelters through a statewide coordinated shelter decompression effort. This is being managed through one of the state's Unified Command Emergency Support Functions. It's the ESF6, Mass Care Housing and Services, which has a homeless shelter work group that is co-led by CCH and the Department of Housing. We're also working closely with some of the other ESF functions, ESF3, which focuses on public works. That's really the vehicle by which alternative sites are being secured, as well as ESF1 transportation. The money for this shelter decompression effort is primarily coming through state funds. Although there have been some instances of municipalities also covering the cost of hotels. Over this past weekend, the state got FEMA approval to get reimbursement of 75% of those costs. And we could talk a little bit more about that as well. So let me talk through what the process looks like. Last week, we worked with each of the coordinated access networks to help them understand on a regional basis which shelters really need to be prioritized for decompression. In other words, which are the shelters where social distancing, spacing beds apart, would be impossible given their configurations and their census. And to determine what their hotel bed needs and room needs would be, both for those that need to be relocated now, for any anticipated inflow, also designating some rooms that could be used on a single occupancy basis for isolation in case residents begin to show symptoms once they've been moved in, and also rooms for staff to provide support within those hotels. The Department of Administrative Services and the Department of Housing have been working to secure hotels to accommodate those needs. That's something that's happening as we speak. Contracts are being finalized today for many hotels, I think close to 800, if not more, hotel rooms across the state. they've been in partnership with a number of different hotel owners to secure those hotels. And then we are going to coordinate with the coordinated access networks to ensure that they're providing transportation to relocate residents. In some cases, the Department of Emergency Management and Homeland Security will be providing assistance with transportation. And I know some of you are working with your DEMIS regional coordinators already. And the shelters and the shelter service providers are expected to provide on-site staffing, meals, as well as services, and also, again, revive this connection to housing focus. One of the things that we still have yet to do, this has already happened in some places, but not all, is to work closely with local health departments and healthcare partners, either community health centers or hospitals, on ensuring that medical care is provided within hotels or shelters in the case where people begin to show symptoms or are suspected of being positive, to develop protocols for how to access testing, how to isolate people who are pending testing, determining when hospitalization is needed, how hospital step down or respite will be provided, and how to safely discharge people from hospitals back to other settings. That's something that is in progress. I know a few municipalities have already stepped up and done that in partnership with their homeless service providers. We are going to be working with Department of Public Health to really figure out what is the guidance that can go out that would be helpful to ensure that that happens everywhere. So that's something that is to be determined. The rough timeline is that the contracts are being executed today and tomorrow. We're going to coordinate with the coordinated access networks and the shelter providers to do move-in into those hotels over the next 2 days. And then the plan is to hotel individuals through the end of the governor's emergency declaration, which potentially could be extended, but for now it's through the end of that declaration. Some of you saw that the governor issued an executive order that really authorizes this shelter decompression effort. This really just formalizes the fact that there's this effort happening. It also was a requirement for the state to be able to seek FEMA reimbursement for these costs. As I mentioned earlier, FEMA will cover 75% of the costs related to this hoteling effort. I believe the plan is to include not only the cost of lodging, but also staffing and supplies and food and meal delivery. So as this process is happening, the shelters and the CANs have committed to ensuring that there will be staffing within these hotels. In some cases, there'll be 24/7 staff on site. In other cases, there'll be staff during the day hours and on call at night. That is being worked out at the local level. What we are finding is that the shelters and CANs are committed to doing that. They still have some needs for supplies, and they're working with Department of Housing to identify what those supply needs are. But again, any donations and things like that would be helpful. In a couple of locations, they're having a little bit of shortages with staffing or volunteers for their shelters because some of the staff have been high risk. They've been redeployed to not have in-person contacts. In other cases, they've had other redeployment of staff that has created some staffing challenges. We collectively at the state level need more funding for flexible financial assistance. Department of Housing has already put in some additional resources, and so has CCH, but we're always seeking more funding to help with things like security deposits, move-in costs that can help with our rehousing effort. And as I mentioned, the focus of this hoteling effort is meant to be temporary. We do want to move people into permanent housing as quickly as we can. We are looking for any information on vacant rental apartments, whether private, public, or subsidized, so we can collect that information, share that with the shelters and the CANs so we can rehouse people. We've created a webpage, cch.org/COVID-19, where we're keeping all of the guidance from the Department of Housing, as well as some of the information and resources that we've compiling from the federal government, as well as examples of protocols and plans from the shelters and the coordinated access networks directly. So with that, I'm going to end the presentation, and I'm going to turn this over to Commissioner Mosquera-Bruno.
Good afternoon. I'm not that technology savvy, so thank you for having me in this call. Just as Richard mentioned, he went over most of the work that the Department of Housing with our sister agencies have been working on. As he mentioned, our first step was to try to get the seniors out of the shelters. So in the first 2 weeks, we authorized 100 rooms in hotels, double occupancy. And that was pretty successful. We were able to move a lot of the seniors out. Then the second goal was to decompress those shelters and working with the CANS and with CCEH. We have been doing that and having hotels to do that. The department also increased the resources for rapid rehousing. So we allow the $735,000 for assistance to help a rapid exit with all the CANs. So that's on the shelter piece. We work pretty close with the public health departments, pretty close with municipalities. I called personally many of the municipalities, the mayors, and the public health department and the shelters, just to make sure that if they needed any help, we were available for them. We didn't want to dictate what they needed to do, because in many cases, many of the municipalities, they already have good relationship with their hospitals, they have good relationship with the nonprofits, and they were developing their own plans. So my reach out was to make sure that they knew that the state is there to support their efforts and to fill in whatever other needs they had. We also, on general, overall, with the departments, we eliminate the 30 days period to change income verifications for families that receive Section 8 vouchers. So we manage about 13,000 rental assistance and federal vouchers. So if a family income changes, and many families are losing their jobs, so how it usually takes 30 days for us to reassess. So we eliminate the 30-day period. If somebody lost their job, they can just call our vendor, Demilia, and then they will adjust. So meaning that if they cannot pay their portion, the state will pay their rent so that they're not going to be evicted. Let me see what else we did. So it has been moving so fast. We have been working on many different angles. Steve, are you on the line?
Yep, I'm here.
Do you want to add a little more on what we have been doing?
Sure. I think between what you have said and what Richard has said has really done a great job to cover the full depth of this. It has been an extremely fluid situation. We've had numerous plans in place really to deconcentrate those homeless shelters, but in the end, we really decided that the hoteling option provided the best thing going forward. We also realize that our work is not done once we do move folks into hotels. We have a lot of work to do. We have to ensure that those hotels remain safe. We have to ensure that we provide the proper food and medical resources that may appear. We also are working on policies and procedures when somebody does become COVID positive, how isolation space will work. We're closely working with our hospital association for when our population does need to go to the hospital and when they are discharged, and where would they go after that once they no longer need hospital level care, but they're still COVID positive. And then obviously, like Richard said, our ultimate goal is to try to get as many of these folks housed permanently in the community, because ultimately that is the best for them and for their health, as well as the public health for the entire state and all of our residents.
So I think with that, we'll finish our report, and we will be open for questions.
Yep. So I think we'll turn over to Dr. Sosa now from Department of Public Health.
Oh, Dr. Sosa.
Hi. Can you hear me?
Yes, we can.
Okay, great. So I don't have a lot to add. This is actually really helpful for me. So hi, everybody. And I think, thank you for inviting me, and thank you for having DPH be part of these discussions. I see our role as twofold. First is making sure that the appropriate guidance is out there and that we're supporting you, and making sure that we are giving you the best guidance and best practices, especially as you transition population to this new setting. Because even though they're in a new setting, doesn't mean that there's still not a risk there. And then I think also it's helpful for me to understand, and it's really great that there have been discussions with local health departments and that they're part of these discussions, because they are very important. And so if we can assist in making connections where they haven't been made, I think that's also really important. So I think these next month is really critical. You know, we are continuing to see increases every day. So we're kind of on that upward slide or increase of our cases. And we're hoping that everything that we're doing right now in terms of social distancing and everything else is going to flatten that peak. And I think the next month is going to show us really the true impact of that. So I think these next couple of weeks are the most important, but as Steve and Dr. Cho and the Commissioner mentioned, it's not going to be over in a month. It'll just change like everything else has changed over this time. So I think for right now, if there's any questions that I can answer, and again, for me, it's identifying what guidance and support that we can provide in your efforts going forward. Thank you.
Terrific. Thank you so much. Oh. I'll be there in a moment. Come on, Daddy. Hi. I think we're all doing something like this right now. Excuse me. So we have our chat box open for people who have questions. So first of all, thank you again to all of our presenters today, and for all of you for being here, and of course to CCM for hosting. So our first question today is from somebody who wants to know about people coming out of the Department of Correction facilities into communities. How are we handling that? Obviously, some of the people coming out of facilities have supports, but what about people who don't have those natural supports?
Yeah, so Madeline, I can take a first crack at that. I don't say we have the solution for everybody coming out of the Department of Correction. And as you noted, there are many people who do have family members or their own homes that they'll be returning to after DOC. But we and Department of Housing have been working closely with Department of Correction, as well as the Office of Policy and Management at the state, at least to solve the issue where any inmates that are hitting their end of sentence, where DOC is legally not able to keep them, they're also not able to provide them with parole supervision or a halfway house connection, that the end of sentence population, many of them have been coming to homelessness. As we've been working with our CANs to reduce new shelter admissions so that we don't further crowd our shelters, it's created a challenge where anybody leaving DOC who was either falling into homelessness after their release, or who was actually frankly returning to homelessness because many people were homeless prior to their most recent DOC admission, would it be end up on the streets, and that would not be a good situation. So in the last week and a half, we worked closely with state agencies to create a rapid rehousing program that would serve individuals who are being released from Department of Corrections at end of sentence. It's flexible money that allows us to cover short-term housing as well as temporary rental assistance in permanent housing. The money is fairly small. We project that it might help us with the next set of people who are released over the next month or so. And then there's some questions about how we might grow and sustain that pool of funds. But we are rapidly working to design and work with a rapid rehousing program. We've recruited nonprofit providers across the state to assist us with this effort. And we'll be developing that fairly soon in terms of ensuring that DOC can make referrals to providers to ensure that there is a seamless transition from prison into both potentially a hotel or temporary housing and eventually into permanent housing. And again, we know the scale of need is probably much greater than what this program can do right now, but we're hoping to grow it over time.
Okay.
Steve or Commissioner, I don't know if you have anything to add to that.
No, I think you're right on there, Richard. I think this just builds off some of the work that we've already done before COVID-19 really hit, really focusing on those folks who are incarcerated and are exiting homelessness, because we know there is a pretty large cohort of that. So we've just building on our experience in the programs that we've already administered. We know that they work, so any way we can expand those during this time is what we are trying to do, and is what we will do.
Great, thank you. The next question, I was just notified that hotel rooms have been secured for my municipality's homeless. Can you tell me if the rooms are for all homeless individuals or just for those who need to be quarantined? Will food be provided to the hotel, and if so, by whom? Who makes the decision to hotel someone? And will it be up to the local shelter to screen residents and make those arrangements?
All right.
So Steve, you want to take it, or do you want me to do it?
Sure, I'll start with it. You can fill in some of the gaps. So this has been quite a Herculean task, like Richard said, being put together relatively quickly. So each community, we really went out to our coordinated access networks to identify what their true needs were. Based on the reporting back, we worked with our sister state agency, Department of Administrative Services, to secure those hotel rooms. In some instances, it may have been a little bit difficult to find a hotel space within the individual community from which it's from, or where the shelter or the homeless population is, and we're doing our best to locate folks as close as possible. Our goal ultimately is to keep the homeless population within a very close jurisdiction to where they are coming from. So when you're talking specifically about those 17 beds, for the most part, those are going to be folks that are from your own community. They're not going to be coming from a different spot, with an exception here or there. As it relates to how people are going to get in, for, as Richard said in the beginning of this, it really is about deconcentration. So this is not that we're taking people who are exhibiting symptoms now and trying to isolate. Our ultimate goal here is to deconcentrate the shelters, take people who are healthy, put them in hotels where we can. If folks do start exhibiting symptoms at that point, that's when we'll work with the local public health as well as the state Department of Public Health to figure out what is the best path forward for their health care going that way. Once again, food, transportation, a lot of that is locally based. A lot of shelters will be able to move folks into these hotels, and then they'll have the ability to staff them. They also have some good connections to food resources in their community. So that will really be based on a local setting. However, if there are communities or hotels that are having difficulties with any of those, obviously we are here at the state as well as our nonprofit partners to identify where those gaps will be and work through our unified command structure to try to fill in those gaps to make sure that all these folks have the proper transportation and food needs as we move forward. I don't know if you want to add anything to that, Richard.
I think you covered it, Steve. The only thing I want to just emphasize is we work closely with each region and shelter to determine what their deconcentration needs are. In most cases, they're mostly moving out some of their shelter residents into hotels. As Steve mentioned, that we're doing this proactively, preventatively. So we're moving non-COVID positive cases into the hotels now. We suspect some of those folks may end up showing symptoms or being COVID positive in the future, as any one of us are in the same boat. But in some limited cases, there are some shelters where by the time you deconcentrate the people, you're only left with a handful of residents at the shelter, and therefore it doesn't make sense to have split the operations between the shelter site and the hotel. So in some of the smaller shelters are basically moving their entire operations to those hotels, but that's not the case for everywhere. And want to just really be clear, this is not a mandated decompression. This is not every shelter that's being decompressed. This is one that we've done in partnership with each shelter and the regions to really determine what makes sense to really maximize social distancing. We have another question.
Yes, so there's a couple of questions about how this is all getting paid for. So who's paying for the hotel rooms? And if a municipality wants to help our local shelter, how can we be ensured that those expenses will be eligible for reimbursement? So a couple of financial questions.
So for the most part, the state has really worked together with state agencies and the Office of Policy Management to identify funding that will be able to pay for these hotels. So right now, the Department of Administrative Services is working with those contracts, trying to get them under contract with the hotels. So the state is going to pay the vast majority of those. In instances, and then at some point we'll work with FEMA to get that reimbursed at 75% according to the emergency disaster declaration. If municipalities have already put forward some hoteling costs, like I know there's have been some. We are working, and we will work once we kind of get everybody settled on trying to determine how we can potentially get that reimbursed through FEMA. So if there's any municipality that is interested in expanding on their hoteling for the homeless population, please just get in contact with one of us here on this call, either through the commissioner, me, or Richard, and we can certainly work out some of those details from there.
Mm-hmm. And so if a municipality wants to help our local shelter, how can we be ensured that those expenses will be eligible for reimbursement? They should just be in touch. Yeah. Okay.
Yeah, I think that's the best. That's the best for now. Just please reach out to us, and we'll work on whatever those specific plans are.
Great. Thank you. We have a town resident who tested positive and cannot return home due to the other vulnerable members of that household. Are there any resources or direction you can give to municipalities on how to address this issue?
So we certainly have heard of instances where that has occurred, and I think that's where we will be working with our unified command structure to identify potential resources for that. I know that we've had very cursory conversations because we know that this is going to be an issue, but really this plan here was really focused on that homeless population, but we do realize that there are other folks out there that are going to need some type of isolation space. So we'll be having those further discussions with our state partners.
Will isolation areas be identified at hotels?
Yeah, I can. So we work with each of the shelters and the CANs to ensure that the hotel needs that were being identified was not only to move people into hotels. The major plan was, again, as we're decompressing the hotels, we're looking at double occupancy rooms within hotels. In addition, we asked the CANs and the shelters to identify what additional rooms they would need that would be used on a single occupancy basis to do isolation of any people who begin to show symptoms and who are either seeking testing or pending testing, that we would keep them isolated in those rooms. Again, the plan is we're not moving anybody COVID positive into the hotels. In fact, I don't believe there's any COVID positive patients or residents in shelters currently. There have been a couple of instances reported in the media where people who are unsheltered or staying at a warming center were identified as COVID positive, but nobody in the shelters currently. We're moving them into hotels, but we have anticipated that we will need isolation spaces within those hotels if the now hotel residents begin to show symptoms. And so we've also added that capacity within the hotel rooms as well. In addition, have included rooms where shelter staff can actually use those rooms as well. So there will be some isolation capacity within the hotels. We're not sure, obviously, nobody has a crystal ball, so not sure if those will be enough. And so I think there's also other efforts to identify both isolation spaces as well as hospital respite step-down spaces as well. And Steve or others, if you want to jump into.
No, I think that's right on.
We have a limited number of beds in our region. Even though the case reporting is low in our region, we have limited hotel rooms. How are we working with municipalities to find housing spaces for them?
I think we certainly have come across that with dealing with our Department of Administrative Services and trying to identify hotel space that is close. So there are some communities across the state, particularly in the northwest and northeast corners, that has been a little bit difficult to identify those spaces. So we're doing the best that we can. And if we can't find it in the exact community, that's where I stated earlier, we may have to move to a surrounding town that will have that actual hotel space available. So that's kind of where we're focusing our efforts on there. In addition, we are working with our connections, our shelter staffs in those areas to help us identify additional needs, especially if folks do have to go a little bit farther on how we connect them to their other services that are necessary for them.
Okay. How does the Red Cross fit in? I understand that if we have 50 or more unsheltered people, the Red Cross will open an emergency shelter in our town. Has DOH or CCH been in touch with them?
Yeah, so they are, American Red Cross is definitely part of the ESF 6 homeless shelter decompression work group. So we've been communicating with them as part of this effort.
So the next question: how will each municipality be responsible to provide their own staffing, behavioral health, medical, etc., food and transportation at the hotels?
I think our goal in the beginning is to really work with already existing staff at the shelters to provide a lot of that, but I think we also realize that now is the time for all hands on deck. So like I said previously, if there are municipalities that have resources that we can tap into to assist us in providing that, I think we would gladly accept that assistance and really work with them to provide as much care for these folks as we possibly can get. Because like I said previously, ultimately the goal is to try to slow the spread of this, if not prevent people from getting it. So I know just in these last couple of weeks, even within state government, my breadth of contacts has expanded greatly to be able to work together to fight this. So I would love the opportunity to work with any municipality as well, because I think if we all kind of work together, we can really make even a larger difference than what we're doing on the state level alone.
I'll just add a couple points to that. One is that the shelter providers are being asked to provide basic operations and case management services staffing for the hotels. Where I think there may be some gaps is to provide additional medical and healthcare support within hotels if and when people begin to show symptoms, as well as behavioral health supports, because some of the folks that are in the shelters have behavioral health needs that may be challenging. So I know there's some conversations happening at the state level between agencies, DPH, Department of Mental Health and Addiction Services, to figure out how additional enhanced staffing can be provided within those hotels. The providers are expected to provide meals to the hotel residents. In some cases, the hotel contracts actually come with breakfast, so they're able to cover that. And I have to really give a shout out to the hotel owners who've been cooperating with Department of Administrative Services and Department of Housing. They've really stepped up in many ways. And then with regard to transportation, that is being handled at the local level between the providers. In some cases, they've already been in communication with their municipalities to assist with that. And then the DEMIS regional coordinators are also at the ready to be able to provide additional support if needed.
So our next question, one of our local shelters asked about assistance with hotspot or Wi-Fi for students to use for laptops given for schoolwork. How are we taking care of this, or do you have any suggestions?
That's a great question. As I also try to distance teach with my kids, so I totally get it. So that is something that literally just got brought to our attention maybe last night. So I think that is something that we also, once again, have to kind of work with our other sister state partners and kind of open up that conversation. When you really look at the focus that we've had on this deconcentration, a large majority of that has been related to the individual shelters, because those are the ones that are kind of packed tight, like Richard said. A lot of our family shelters tend to have their own individual rooms, which therefore leads to own isolation spaces. But I can certainly see that some of the other issues that are going to come up with family shelters that will not come up with individual shelters, which really is about distance learning and about education. So that, like I said, just came to our attention. So I'm glad that somebody else is bringing it too. So I think that is another bullet point that we need to address, especially since we will be getting folks kind of set up in these hotels over the next couple of days. We really need to move more away from the crisis management of this, more into the implementation phase to get folks settled in, getting them on the path that they need to go, and providing them the full level of service that they need, whether it's mental health, substance abuse, education, food, and all of that. Madeline, I think you're still muted. It looks like you're trying to read another question.
Yep, trying to juggle all that. There, sorry about that. So Hoween asked, she said, actually, she told us, in our district, we contacted Verizon and they were able to help us get Wi-Fi hotspots. So that's great. And that's, a big part of why we wanted to bring everybody together today, is so that we can share. So I know we have one more question right now. I hope they'll keep rolling in as long as you have questions or things that you want to share with each other, because we want to really make sure that we're creating an environment where you all can hear from each other and can ask questions not only of our speakers but of each other about how you're handling this. So thank you. The next question, are there any examples of municipalities that are really nailing the response to COVID? Wow, that's a big one. Thoughts?
I can, it's a difficult question because there are many municipalities that really have been very thoughtful about putting a plan together and working with the hospitals. So I can cite a couple of those. In Hartford, we talked to the hospitals, the public health, the mayor, and we all in the shelters. So they're all working together. New London has been unique. They went on and actually leased a nursing home, and they got volunteers to fix the heating system and put the about 78 beds back to work, that if any of the homeless population have any get infected, they can put them there if they don't need hospitalization. So they really have been very proactive. They have a shelter with working with the hospital and the public health department. So I was very impressed with many of the municipalities, as I said. Some of them trying still to find some resources, and some of the other ones working together. And as I mentioned to them, because I have many, many conversations with municipalities and public health, is that this is something locally that we have to address, and that the state is there to provide the support that they need. And we stand behind all of them.
Great, thank you. And if other people on the call have thoughts about who's doing things well, please share them. Actually, the next point was one from Kathy Ahern, who runs the Russell Library in Middletown. I want to let you know that libraries are trying to keep information on their web pages on resources for people in need. We are doing lots of virtual work, but really miss our patron connection. So, so thank you, Kathy, for sharing that.
Madam, that's a good point to raise, which is one of the things that we have yet as both CCH and the state to address is how we're addressing the needs of people who are unsheltered. As many people know, not every homeless person uses shelters or chooses to enter shelters. With shelters reducing new admissions, many of the warming centers that are closing because the weather is getting warmer, and also that libraries and other even businesses where people who are homeless during the day will hang out and use facilities, and soup kitchens have now moved towards grab and go meals. A lot of people have been shut out outside, and they're similarly in a challenging situation with respect to having access to bathrooms, showers, places to actually get basic services. So they're also in danger of COVID-19 infection and spread. So it's something that we're working to address. I will say that the hoteling needs, I have fingers crossed that we'll be able to include additional capacity in case some of those folks do want to end up coming inside. Maybe not all, but certainly some. And I think one of the things that we still need to address is figuring out how do we meet the needs of those populations and libraries have been such a huge partner in serving the needs of those folks, at least during the day.
And on that note, Jen Paradis, who runs the Bethel Shelter in Milford, said, shout out to Milford Library, who is making face guards on their 3D printer. So that's great. So Haween again, let's see. Oh, my box is going a little crazy here. Are we working with towns and the local police to identify encampments? Oh, that's a really important question.
Yeah, I think most of the homeless outreach teams and law enforcement, actually prior to our COVID-19 response statewide, we were already working on trying to develop a better strategy. One of my colleagues on our team, David Gonzalez-Rice, was working closely with folks at the Department of Mental Health and Addiction Services and DOH on developing a statewide strategy. Oh, and by the way, shout out to United Way of Connecticut, who are also part of that work to really develop a more concerted strategy for how we both identify people who are unsheltered or sleeping in encampments and how we are able to track them. We've been learning from the examples of places like Middletown, Milford, Norwich, and others where they've had really strong homeless outreach consortia, where municipal services are working with homeless outreach teams to really better identify people who are in encampments or sleeping outside. And obviously that work has become even more urgent with COVID-19. The federal guidance has been, and that's actually posted in the group chat from my colleague David, federal guidance has been right now from CDC, do not clear encampments right now and try to provide services to people in encampments. The clearing and dispersal of encampments right now could potentially be even worse and helping what would actually do would disrupt people's access to their own possessions and things that would actually help them keep them safe. So that's something that we're keeping track of at CCH, and our colleague David Gonzalez-Rice is really working on figuring out what can we do to better ensure that people who are in encampments or unsheltered have access to basic services in this time.
And those, as Richard said, that guidance is in the chat box. It's also available, as mentioned at the very beginning, at cch.org/COVID-19. You can find the CDC guidance and a lot of other guidance there. I think we're at the end of this chat box. I want to give another moment in case, do people have any other questions, shout outs, thoughts, things that you want to raise right now? We want this to be a conversation that we keep going with all of you. You will have our contact information, and you should just connect with us. We want to be connected with you. We actually have a municipal working group that before all this happened was thinking about how to make sure that we were helping support all the wonderful people working for municipalities across the state and having what you need and having the support you need in addressing homelessness in your communities and as a state. So do keep connecting. And I do want to, there's another one here, Kathy Ahern again in Middletown. Russell Library staff are making masks and doing well calls to seniors. If there are any resources that you would like us to post on our webpage, please send it along. And she included her email address. So that's great.
Madeline, if there's no other questions right now, maybe I could just use a few seconds to get on my soapbox for a second. I mean, since the COVID-19 pandemic started, the governor's really stepped up in his leadership, and the message has been to stay safe and stay at home. Well, it's become really clear that home has become such a protective force, something that we've always known at CCH, that home is healthcare, housing is healthcare. Yet it's never been more true now. And so I think I urge everyone on this call to think about how some people in our state aren't able to stay safe and at home because they lack a stable home. So huge credit and kudos to our state leadership, to Governor Lamont and to Commissioner Mosquera-Bruno, to our DPH Commissioner, Dr. Lynn Sosa, and others who are assisting us to ensure that we can give people who are homeless the best opportunity to stay safe and be at home. And so first and foremost, through hoteling, but eventually to connection to permanent housing. So I just want to really praise the state for the leadership in this, and also to all the municipal partners who stepped up as well, both early on and now are working closely in collaboration with all of us. So I really just want to thank everybody for that effort.
That's terrific. I'd like to ask our other presenters, and you can keep them coming, by the way. It looks like we're wrapping up, but if you do have other thoughts or questions, please include them in the chat box. But as we're wrapping up, I see Dr. Sosa. Do you have any sort of thoughts to wrap up with?
I think I'm unmuted. So I would just say, yeah, I think it's every day is a different day, and I think that the coalition is moving forward in a really good way, and it's just a matter of supporting you all in those efforts. And so I will say this has actually been really helpful for me to kind of see where things are going, and will help us make sure that we can support you in the best way and most efficient way possible. So thank you.
Perfect. Steve and Commissioner Mosquera-Bruno, do you have thoughts to close with?
Yes, I just want to say thank you to everybody, especially to join the call and to be informed. As the governor said, we can only, we're going to get through this, but we're going to get through this together. So anything that we can do, any assistance, any thoughts, they're all welcome. Just so you guys know, we are going to organize a conference call with developers and property managers to see how we can help through this process and how we can eliminate some barriers so that we can produce more housing, because that's our number one goal is to produce more housing so people really get a place to live. So that's it.
That's great. Steve?
Yeah, I'd like to echo those sentiments as well. And I think we have come a really far way in a couple of weeks, being able to pull off this effort of moving a large percentage of our shelter population into hotels. But I also know that that is just the first step. Like I said before, I think we're going to have a lot of additional management to be able to ensure everybody's safety. And obviously, like we all say, the ultimate goal of this is to find people permanent housing. So even when the COVID-19 issue hopefully dissipates soon, we would love to continue our relationship with CCM. We'd love to continue our relationship with municipalities in any way possible in identifying housing resources. The state has a bunch, the federal government has a bunch to actually house people. So if we could continue to work together going forward to identify places where we can house people, that would be really appreciated, because if we can drive down our homeless numbers even lower, the next time anything like this happens, we'll be in a much better and more prepared situation.
We do have another, I think it's great that we have more questions. Another question from Hoween, that it would be great to hear about domestic violence resources and how that fits in with this whole thing. So that if our speakers could speak to that, that would be wonderful.
Sure. So with domestic violence partners, we really have started to engage them in a way that we haven't seen in the past couple of years. So I've certainly been able to be in contact with some of our domestic violence partners. We also are in contact with the Department of Social Services, because they are the ones who actually fund our domestic violence shelters. So I know that on the housing side, we've been very engaged, offering our rapid rehousing resources to those domestic violence partners as well, so they can get the folks out of their shelters and back into permanent housing. And we also will engage with them on similar plans if they need assistance with deconcentration of their facilities as well.
Terrific. So the only other thing I see here is a question about whether the PowerPoint will be shared, and if there is contact information for the presenters if we need to follow up. We can absolutely share that. We'll look to our partners at CCM to share our contact information. And please do stay in touch. We are very interested in being in touch and hearing from you about your needs, your ideas, your thoughts about how we can continue to partner. Oh, and then just when you think, here's another one. We're receiving phone calls regarding residents looking for rental assistance to avoid eviction and homelessness. Does anyone know of any programs that can help with the prevention of homelessness?
So DOH has a variety of different programs that really address that. So our general answer for that is anybody who's experiencing a housing crisis, please call 211 to kind of get them on the process, because there's a variety of different resources that we can, and 211 serves as like the gatekeeper to that, and then we can kind of move forward from there. Like the commissioner said, we've also put in place for some of our supportive housing and our Section 8 programs, assistance to be able to recalculate the rent. Obviously now there are also the governor has put into place stoppages to evictions along those lines. So we do anticipate when this does end, we're going to have to deal with some of those issues as well. So we're well aware. We do have some resources, but some may be very specific to specific types of populations. So if anybody has that, please call 211 to get that process started.
Any other comments from our speakers or questions? Thank you all again. I want to pass this back to Brian from CCM just to wrap up, but we're just so grateful to everybody who's involved. So
thank you, Madeline. And on behalf of CCM, we just want to thank our partners, the Connecticut Coalition to End Homelessness, also the Department of Public Health, and the Department of Housing. I think what this kind of shows and demonstrates is the fact that coordinated efforts is what's going to really help hopefully stem the tide of the spreading of the COVID-19 disease. And I think just when Madeline and Richard approached us about setting up this webinar and how much has changed even since that day. It was probably just over a week ago that we started planning this, and to their credit, they saw a need and they saw us as a resource, and we're happy to participate and help not only educate our members, but also try to develop best practices and resources. And I think the other important thing is the partnership with the state. I think it's been great in moving forward, since the executive order 7P came out. We're starting, the recognition, I think, was elevated. So I think to the extent that Governor Lamont elevated the conversation and brought it front and center, I think was important. And I think, we already had the relationship with DPH and CCEH and DOH, but I think it's even stronger now. And I think, building on, Madeline mentioned it before, the task force that we have at CCM on homelessness. I think this is kind of actually positioned us to kind of respond and be helpful. So again, I just want to thank our speaker, Madeline. Thank you for co-hosting, and also Steve DeLella, Dr. Sosa, and also Celia Mascaro-Bruno, the Commissioner of DOH, and Richard Cho for all your help in putting very informative information out for our membership, but also the community beyond. So again, we want to thank you. Right now you see on your screen, these are avenues for you to share resources, but also to be able to contact us. And, if there's any, holes in part of the process that we're doing, this is a good avenue to get those out there, but also to be able to get us in communication with our state agencies and partners. So again, on behalf of CCM, we thank you, and we thank all the panelists, and we thank you for joining us.